Finally, I'm going to layer in my enamel layer, and I need a minimum of a 0.5 millimeter. How do I know I have that? Because I left a 0.5 millimeter of space in my dentin layer. If your dentin layer gets too thick, if you actually come out beyond the final labial position of the tooth in your dentin layer, you're going to apply this enamel layer, and then when you polish the tooth, you're going to just simply start to just remove it. And remember, as I've done this, you can even see that the composite is looking a little more translucent and a little more chromatic than the adjacent teeth because the teeth are getting brighter and whiter. We've done the same case throughout. We originally said we thought that those laterals were in the range of maybe an A2 or darker, and now, gosh, you'd probably say they're like B1 because they're dehydrated. So I actually am really liking the fact that the composite is looking a little more translucent, so a little grayer or lower value, and a little more chromatic. Now I'm going to pick my appropriate enamel shade. I'm going to layer that on there. Everything's going to get light cured. Put on your interproximal strips so that you can go in and do your interproximal contacts. And then really you're at the phase where now it's time to just start to trim everything back. You can see that I've trimmed it back. I've got my incisal translucency coming through at that incisal edge. We can see the lobes of dentin. I've actually shaped the incisal of the tooth to mimic the natural tooth. And I've actually now taken and I'm putting in surface morphology. I'm actually putting in those striae of Retzia before I polish. So at this point they're a little bit deep, and then they will actually be sort of polished down just a smidge when I do my final polish. So there we're going to do our final polish, and now really my job is to say, yep, I need to see this in a week so I can see what happens for the final shade match. And if it's still a little translucent, I may take a little bit off the lingual and add something a little bit more opaque to the lingual. If it's a little too chromatic, I may prep away the facial a little bit, get rid of a little of that dentin shade, go to a lighter dentin shade, and then redo my enamel shade. So I can tweak it without going all the way back down to the prep. So when we think about doing that and getting really these beautiful, exquisite restorations and having our composites disappear, it takes some skill. And, part of that is we do think of, well, we'll go to ceramics because ceramics, we can get better aesthetics. I would tell you that I think you can get equally beautiful aesthetics in composite. And, there's advantages to composite that like not having to have a temporite and being able to do it right there for the patient. In a young patient, I like composite being a little more resilient given they're going to go play sports and do things like that. And truthfully, sometimes we just like composite because I get to be the person in charge of the aesthetics. So instead of trying to communicate that back and forth to a laboratory where we have that trying to use words to describe a visual, I can actually play right there in the mouth. I can actually see what it's like, sort of the equivalent of custom staining by custom changing the composites.